There are some other ongoing clinical trials that I've highlighted in this slide. Some of them are also small molecule inhibitors. Some are small molecule inhibitors selective for HER2 mutations. Some are for HER2 and EGFR mutations. Some are antibody drug conjugates, just like TDXD, and some belong to a new group called bispecific antibodies. I have the clinical trial numbers here as well. And so for those watching this video, you can always discuss with your oncologist whether any of these trials would be the right one for you. And if you're interested in discussing them further, you could look them up with your doctor. This slide just briefly highlights what frontline trials we have. So till now, a lot of what we've discussed, whether it was zongertinib or TDXD, was in the second line or greater setting. So patients who had already received some type of therapy in the frontline setting, but the therapy was not able to control the cancer. SOHO-2, which looks at cevabertinib in the frontline setting, Be My On Lung 2, which is zongertinib in the frontline setting, and Destiny Lung 04, that looks at TDXD in the frontline setting, are all clinical trials that are actively recruiting, and something to consider if you do have or you're diagnosed with a HER2 mutated lung cancer, and you're interested in a clinical trial. So in conclusion, all patients should be tested for HER2 mutations both by next-generation sequencing and immunohistochemistry. Currently, there are two approved drugs in the second line or greater. One is trastuzumab deruxtecan, TDXD, and the other one is zongertinib. Trastuzumab is an IV medicine, it's an antibody drug conjugate, and zongertinib is an oral small molecule inhibitor. Both of them have different side effect profiles. Zongertinib ushers us into an era of oral therapies for HER2 mutated lung cancer, where the hope is that there's good CNS penetrations, a good disease control in the brain, and also lesser side effects. There are more emerging therapies in the pipeline. We talked about cevabertinib. We also talked about some other ones like NVL-330, all very exciting drugs in this space for our patients. And there are many opportunities to be enrolled on clinical trials, either in the second line or greater setting, or even in the frontline setting. And for those who are interested in learning more, I encourage you to reach out to your oncologist to get more information on this. Otherwise, thanks for listening, and I hope this was helpful.